Hello, good day to all. Today I will be presenting on the topic of sickle cell disease. So let's begin. What is sickle cell disease? Sickle cell disease is known as a hemolytic anemia. This type of anemia occurs from the death of red blood cells, which then results in low red blood cell count and low total hemoglobin. Hemolytic anemias create genetic defects in cell structure, immune reactions, changes in blood chemistry, blood toxins, infections, and transfusion reactions. This type of anemia is inherited, which leads to the formation of an abnormal hemoglobin. And the protein of interest is hemoglobin S, or HbS. This abnormality causes the shape of the red blood cell to form a sickle shape due to the lack of oxygen circulating within the blood cell. When the red blood cell becomes deoxygenated, the cell crystallizes, which is why the shape is formed. Here is just a picture of what a normal and a sickle-shaped red blood cell look like. So here's some characteristics between the two, between a normal red blood cell and a sickle red blood cell. So as you can see, it's this shaped, it's deformable, and it usually has a lifespan of 120 days, where a sickle red blood cell is sickle shaped, is rigid, and only lives for 20 days or less. Sickle cell disease consists of a group of complex chronic disorders, not just one. So, to be characterized as a person that is affected or you become a carrier of the sickle cell trait, you would have one normal gene and one gene for sickle cell. So that's the characterization of a carrier. A person who is affected inherits two genes for sickle cell. So you would have SS. So sickle cell disease includes sickle cell anemia and thalassemia. So there's two subtypes of thalassemia: sickle beta plus thalassemia and sickle beta 0 thalassemia. Here is just a chart with all the most common genotypes of sickle cell disease. Within the U.S., a person who has sickle cell anemia is 65% of the population. A person who suffers from the disease is approximately 25%, and sickle beta plus thalassemia is 8% of the population, and sickle beta 0 thalassemia is approximately 2%. Let me add this. A sufferer of sickle beta 0 thalassemia has a more severe case of sickle cell. All right. Where does the disease originate? The disease originates has a higher prevalence in Africa, India, the Mediterranean area, and Saudi Arabia. That prevalence is because the area was exposed to Falciparum malaria, And so also it is known that if you have the sickle cell trait, that you will be protected from malaria if you go to those countries. Here is Punnett squares to show different sickle cell pedigrees. So the one on the left, where you have one parent who was normal and the other parent that has the sickle cell trait. So 50% of the offspring would have the sickle cell trait, where the other 50% would be normal. So on the right, two parents would have the sickle cell trait. So you would have one offspring with sickle cell anemia, two offspring, or 50% of the offspring that would have the sickle cell trait, and then one would be normal. So also, I have the opportunity to meet and interview with someone whose family is affected by sickle cell disease. So in her case, my friend both her parents have the sickle cell trait, so they were carriers. So they had 4 children. So 50% were affected by sickle cell anemia, and the other 50%, they are carriers of the disease. So now to discuss the prevalence of sickle cell disease in the U.S. So 1 to 2,000 to 2,500 newborns are born with sickle cell. 1 to 500 African American births. 1 to 12 African Americans are carriers for the disorder, or 2.5 million people in America, which is why sickle cell is more known amongst the African American population. 1 in 36,000 Hispanic births. And typically the average life expectancy of a person who suffers or is affected by sickle cell disease is to their mid-40s. The mortality rate used to be higher before 1999. So with the introduction of newborn screening and a vaccine for pneumococcal disease was introduced, the mortality rate amongst African American children younger than 4 years old dropped by 42%. Here is just a list of risk factors, symptoms of sickle cell disease. Typically, the symptoms are acute crises or abdominal pain, breathlessness, fatigue, heart problems, jaundice, joint swelling, leg ulcers, and a weakened immune system. And if they have those symptoms, it increases the risk for erectile dysfunction, infections, iron overload, where a blood transfusion would be needed, organ damage, stroke, or vision impairment. Typically, a person who is currently living with sickle cell, they go through checkups every 3 to 6 months, where they will have routine immunizations. They begin penicillin prophylaxis to prevent the spread of pneumococcal disease, and they generally have extensive lab tests and a physical exam. Also, they need to maintain fluid and nutrition levels. A doctor will have a special interest in making sure that they have neurologic testing, cardiac, and eye exams, due to the risk of blood vessels rupturing or new blood vessels forming, and they're very weak, so they'll just burst and bleed. Typically, if you come in contact with a person who suffers from sickle cell, they talk about going to have a crisis, or typically is basically an emergency. And so, whenever they go through a crisis episode, they typically have fever or infections, acute chest syndrome, eye trauma, stroke, priapism, splenic sequestration, and severe pain. One thing that is important when living with sickle cell is pain management. So it's very important that they assess the pain level and they treat the complications that go along with that pain. So for mild to moderate pain, they typically take acetaminophen or NSAIDs. For moderate to severe pain, it goes into opioids, morphine, sedatives, and anxiolytics to increase the effectiveness of the pain medication. Currently, there is no way to prevent the disease since it is genetic, but to prevent a crisis is to always eat a healthy diet, have adequate amount of bed rest, avoid stress, avoid too much physical activity, and drink plenty of fluids. A person with sickle cell disease, they have a treatment plan, and that treatment plan is typically ongoing. So it includes blood transfusions, bone marrow transplants, folic acid supplements, hydroxyurea, taking their medications, typically pain meds, antibiotics, and penicillin, and getting plenty of fluids and oxygen. Here is just a list of the current therapies and research that is ongoing with sickle cell disease. As stated before, there is no cure, but here are the list of the different therapies. So, red blood cell rehydration, anti-adhesion, HbF augmentation, antioxidative therapy, antithrombotic therapy, anti-sickling through multiple pathways, transfusion therapy, transplantation, gene therapy. Currently, we are in Durham County where Durham Tech Community College is. So here are a few of the community resources. Duke University has a great sickle cell center, so it's called the Duke University Comprehensive Sickle Cell Center. If you would like to find out information about sickle cell disease, you can contact the Durham County Health Department. And if you would like to make a contribution, you can get in contact with the Make-A-Wish Foundation. And this is the end of the presentation, and I thank you for listening. Have a great day.